Heather Leonard. I'm nurse practitioner at Walter Ament. I wanted to share a story about an experience I had during the COVID pandemic. I was redeployed to the APC call center, and the one evening I had a patient call to admit to me that she took her diabetes medication against the recommendations of her PCP earlier that day. She had called their office with lower blood sugars, and they had recommended that she held one of her medications that evening, but called me to confess that she did not hold it and was worried about what was going to happen to her. So I did research to see when the peak was for it, and I had asked her to call me back in about 2 or 3 hours when the medication would peak so we could see what her blood sugar was. I'd written myself a note just in case that she didn't call back, so I would remind myself to call her, but she did call and was confused and lethargic on the phone, told me she felt terrible, her blood sugar was less than 30. I asked her if she was able to go into the kitchen with me on the phone to see if she could get something to eat or drink. She told me she could not even get up from her couch. She felt so weak. So I asked her, she was at home by herself, just had her dog with her. So I asked her if it was okay if I called 911 to come, and I did, and the EMS got there, and I think they ended up giving her glucagon to get her blood sugars back up. But yeah, it was just a good experience to treat someone like that, and that's kind of why I went into nursing and decided I wanted to be a nurse practitioner so I could try to make a difference in people's lives and help whenever I can.